We just found this incredible literature review explaining the benefits of laser light therapy in kids with autism. So if you're an autism parent or you're a provider that works with kids on the spectrum, you're definitely going to want to hear this. Welcome, everyone, back to Unraveling the Brain. I'm Dr. Lauren Liming. I'm stepping in for Dr. Josh Mattson today. I'm here with a really exciting literature review that is overwhelmingly positive on the effects of photobiomodulation for a kid with autism. So whether you're a provider that works with kids on the spectrum or you're a parent of a neurodivergent child, this is really powerful stuff. And what I want to do is just take some time, go into what this is saying, and also help make sense of what this is saying, and really lay that out in maybe lay terms and make it make more sense here. So I'll start off with the abstract here, and that's really a general view of this lit review. So this was a literature review in Neurology International, a journal, and this was a compilation of 66 different studies about kids on the spectrum, photobiomodulation. So what that means is using lasers over the brain to help promote brain activity, to help these kids develop. So I'm going to start here with this abstract. So it says, there are a number of key abnormalities in brain structure and function that trigger these behavioral patterns. This includes imbalance of functional connectivity and synaptic transmission, neuronal death, so that's brain cell death, gliosis, and inflammation. So gliosis is when the brain immune cells, those brain support cells that are there to help provide structure and assist neurons, like the productive part of our brain cells. Gliosis means that those brain immune cells get more reactive, they get more agitated, they create more inflammation, and they actually disrupt neurons rather than being supportive. So that's really important stuff. So kids on the spectrum, they have a lot of gliosis, and we run specialized labs here in the office, and we identify neural autoimmunity, immune system attack on the brain. That's through something called a Cunningham profile, or a NeuroZoomer Plus is the lab that we choose. It says, in addition, autism has been linked to alterations in the gut microbiome. So a lot of people are chasing their tail. You know, they're trying to do just things with diet or just things with activity or different therapies or interventions. And this is going to touch on a couple of those. But when you're looking at gut health, that's really dictated by the gut microbiome. And that's the gut flora. That's the beneficial bacteria within the digestive system that help us to break down foods, help us even produce neurotransmitters like serotonin, which helps us regulate and stay calm. And then I'm going to move on here a little bit. It says, this treatment has been shown in a range of pathological conditions, so treatment being laser over the brain, so transcranial photobiomodulation, using a laser over key areas of the brain. And I'll touch on those here also. But it shows that in a range of pathological conditions to improve key changes that characterize autism, including the functional connectivity and the survival of neurons, the patterns of gliosis and inflammation, and the composition of the microbiome. So it really introduces, what's going on in the brain of autistic kids and what's going on in their gut. And then it immediately steps in and it says that this helps essentially all of those things. So just to be clear, we're not curing autism. We are helping provide a very safe, a very effective intervention to help these kids function at a higher level. And that's something that we've been doing for years here. And this literature review came out in 2022, and we just came across it, and it's overwhelmingly positive. So I'm gonna touch on a couple other lines through here. It's about 10 pages. We're gonna include a link to the review here so you can read it. It's in the comments below. But I'm gonna kind of thumb through and make sense of some of these things. As far as functional connectivity and imbalance in the brain of an autistic kid, there's an imbalance of functional connectivity in the brain. And what they found is there's a lot of local, so some small areas of the brain that are really overconnected and really overactive. But when we look at the functional connectivity, that requires big brain activity, big brain networks. That's where we have speech, language, personality, task switching, self-control, planning, working memory, social interactions, and cognition. And then even like repetitive behavior, those repetitive behaviors shows us that we're not able to inhibit. So when you see a lot of stimming or a lot of kids playing the same song over and over or saying the same things over and over, they should be inhibiting those activities. And a connected, a well-developed, a communicating brain does all these things with language and personality and focus and attention. But when there's a disconnect, then that's when you have these delays. That's when you have these symptoms, these issues, these things that hold kids back. And so I want to talk a little bit more gliosis and inflammation. There are clear signs of gliosis and inflammation in autism. So there are some genetic components to autism, but when you look at really what's going on in the brain at the cell level, gliosis and inflammation. Gliosis is a source of inflammation. That's a self-inflammation. The brain's immune cells are causing that inflammation. That inflammation in general is really going to bog down mitochondria. I'm going to touch on that a little bit here. Mitochondria are the energy producing components of a neuron. So if you remember in like 8th grade science class, you learn about ATP being energy currency, and the mitochondria is the powerhouse of the cell or the battery of the cell. Inflammation disrupts mitochondria. So that means inflammation here is disrupting energy production. Lasers help promote energy production directly by stimulating the mitochondria. They also help decrease inflammation. It says, in particular, photobiomodulation will prompt an increase in mitochondrial function, adenosine triphosphate, ATP, the energy currency of the cell, and gene expression while reducing oxidative stress, inflammation, gliosis, and restore cell homeostasis and growth factor levels, together with a restoration of balanced functional activity across the brain. So that means networks are able to start communicating when neurons are healthier, when brain cells are healthier. So reducing that stress allows the brain to function at a higher level, to develop these networks, to develop speech, to develop regulation, maintain attention, focus, and just all the things we need to do as people to really thrive and really excel in this world. In autism, there are considerable mitochondrial dysfunctions and oxidative stress, particularly in the cortex, the hippocampus, and the cerebellum. So the cortex is what you think of when you think of the brain. It's your frontal lobe and your parietal lobe and occipital lobe and these temporal lobes. And together, this frontal lobe really allows me to focus and pay attention, do the hard things, motor plan, form speech. My hippocampus has a lot to do with memory and being able to store memory and retrieve memory, while the cerebellum is incredibly important. We have a lot of videos and a lot of therapies where we highlight the importance of cerebellar health. And within autism, a lot of times these kids actually have smaller and less functional cerebellums. And that cerebellum is where all motor integration takes place. So you're talking about eye movements, eye stability, eye contact, vestibular function, so balance, core stability, postural control. The cerebellum even activates your frontal lobe to allow you to pay attention. So kids with cerebellar dysfunction often have attentional issues, or the cerebellum is also there to gate incoming sensory input. So a lot of kids with autism have inability to gate that sensory input. So sounds are louder, touch is much more abrasive, lights are brighter. That's why they can't handle crowds. That's why they can't handle loud noises, or they're covering their ears. That cerebellum is there to gate that incoming sensory input or dampen that incoming sensory input. And so with kids on the spectrum, the cerebellum is involved, the frontal lobe is involved. So you have executive function and cognition, and then motor delays and sensory issues. And one thing that this doesn't really touch on, but when neurons are inflamed, they are more likely to fire. That's why you have more connectivity, or excessive connectivity, or even more activity in the brain. And some studies have shown that kids with autism actually have 40% more brain activity than a neurotypical kid. That sounds like a positive thing, but a lot of times it's excessive, it's static, it's not productive, it's not contributing to network activity. And network activity is where we have regulation and impulse control and sustained attention and stable eyes and all the things that we really need to focus, learn, and develop. These things being mitochondrial dysfunction and oxidative stress, lead to dysfunctional neuronal activity and subsequent neuronal death. That means that the brain is actually starting to atrophy or to decrease size and decrease its potential to develop. And so when we talk about neuronal death, the brain will see these neurons, or the brain immune cells will see these stressed brain cells and then actually start to attack them. So a lot of times kids will be developing really well and they have a major stressor. It might be a concussion or a toxic exposure or something that really dysregulates their immune system or chronic gut issues. Then all of a sudden they start to regress. And this is really the foundation for regression in those. So some kids might be speaking at 15 months, but by the age of 3, they're not saying anything. That means that they've a lot of times had neuronal death in the pathways involved in their speech. The speech requires a large portion of the brain to really work together. And so that's a network activity. And so when you have neuronal death in important networks, you're going to miss out on function. The important thing is kids are developing gray matter. That's the hard wiring of the brain up until 7, 8, 9, or 10, kind of depending on what literature you look at. But the key is intervening as soon as possible, changing their diet, getting them active, reducing stressors. And this article is really highlighting the importance of photobiomodulation. So I'm going to move on a bit here.
This video is sponsored by Unraveling the Brain, which is actually my course to train doctors to help these kids in the way that we do. So if you guys know anyone and know any doctors that are in your area that are maybe interested in working with kids, go ahead and send them a link to limitlessfoundation.co. So that way I can help train them so you guys have a provider close to you guys. Let's jump to the show.
This says, lastly, taken all together, this treatment appears to tick all the boxes and is an ideal treatment option for autism. In addition, photobiomodulation also induces more long-term cellular changes by activating the expression of various functional and protective genes. In essence, photobiomodulation makes neurons healthier by restoring their function and making them more resilient to distress. So that's really important. So a lot of people ask, like, oh, we come for an intensive, or we do some therapy, or we start using a laser. We're starting to do all these things. How long is it going to last? Well, it really compounds. And here I'm going to kind of touch on expectations of that. And it says further, these studies report, transcranial photobiomodulation treatment over an 8-week period has been reported to improve a range of behavioral issues, including social awareness, communication, motivation, and a reduction of restricted and repetitive behavior. So that's stimming, or repetitive movements, or repetitive speech patterns, or repetitive thoughts or anxieties. And so and these results appear to be maintained for up to 12 months. So just 8 weeks, these kids are holding on to these changes for 8 months. And then when you reduce the stress on the brain, you allow the brain to then build. These kids are primed for development anyway. They're ready to grow. They're ready to develop these networks. But if there's a constant stressor disrupting the function of these brain cells, these networks can't develop the way they should. And then eventually you can miss out on these developmental windows where they're developing this hard wiring of the brain, these new connections, these new networks. In the cortex, it has been suggested that photobiomodulation activates mechanisms that help focus attention or help restore overall balance of function and connectivity across any given symptom. For example, and this kind of goes on, and this might be a tangent, but for example, if patients are suffering from either traumatic brain injury or Alzheimer's disease, both of which have abnormal patterns in the functional connectivity between cortical areas, transcranial photobiomodulation helps correct these imbalances, restoring connectivity between these regions to normal levels. It says further, the use of laser acupuncture in a child diagnosed with autism has been reported to generate a pattern of brain activity similar to that evident in normal children. 2 laser acupuncture studies using 405 nanometer light, and that is the violet light, so a violet wavelength of laser, Those have reported improvements in autistic-like behaviors and decreased measures of oxidative status, so oxidative stress to the brain, in the cortex, the hippocampus, the striatum, the cerebellum, and within the cerebellum, there was also indications of increased GABAergic activity. And that's a really important one here. So GABAergic activity, GABA is an inhibitory neurotransmitter for the brain. It's very calming, it's regulating. So you have neurotransmitters in your brain that bring neurons to threshold, that create firing, that create activity. But this GABA and the violet frequencies have been shown to increase GABAergic activity, which means that it actually improves the stability of neurons. So when neurons are more excited, they can't really communicate as efficiently through networks. But when you create more stable neurons by reducing oxidative stress, getting more blood flow to these areas, helping mitochondria, and then in this case, or in this last line, GABAergic activity due to 405 nanometer light that helps improve that activity and also improves Purkinje cell density. Purkinje cells are those important neurons within the cerebellum that are there to dampen and make sense of that sensory information. That allows the brain to know what the body's doing. It allows the brain to know what sensory information is coming in. And then that allows the brain to then create a proper output to the body. So those Purkinje cells are a major checkpoint in development, in speech, in fine motor, handwriting, gross motor, learning how to ride a bike or catch a ball or use their body effectively. So the 405 nanometer light, violet wavelength of laser, is beneficial for GABAergic, so calming the brain and increasing the Purkinje system. The Purkinjes are there to dampen and calm the sensory input to the brain. So when we have sound or light or touch sensitivity, or they can't stand their clothes, that means that their brain isn't dampening that incoming information, that incoming sensory input. And so improving Purkinje cell density, you're actually making more of those Purkinje neurons to then dampen that sensory input. So we're going to include a link to this below so you can have a read about it, or have a read. I also want to include just a brief testimonial, an email that we received from a parent of a boy that we did an intensive with. He came for 2 weeks. We used a lot of photobiomodulation, a lot of laser. We used a lot of violet on this guy, and we got a lot of massive change. And I want to make sure that everyone can read that. And so if you want, you can pause. We'll throw it up here on the screen so you can have a look at that. A couple more lines from this study, or this lit review. It says, for people with diagnosed with autism, there are few effective broad-range treatments available to treat the abnormal brain circuitry and microbiome environment, let alone the constellation and complexity of their system or symptoms. So things are all over the place. It's not just one thing for these kids that's causing these issues. There's multiple different factors going on in the brain. There's multiple different factors going in the gut. It says, photobiomodulation appears to be an ideal treatment option for autism. In addition, photobiomodulation is very safe with little or no evidence of side effects or toxicity on body cells. So we've used these lasers on thousands of different kids, ranging at all different developmental delays. A lot of kids on the autism spectrum, a lot of kids with motor delays, and really getting energy to the brain, calming inflammation, reducing that gliosis, improving the GABAergic pathways, that inhibitory neurotransmitter, that brain calming neurotransmitter, and then strengthening the activity in the cerebellum. You're able to unlock development for these kids. So we're not treating, we're not curing, we're intervening, and we're providing a safe, effective option to help improve the status, the health, the environment, the function of these areas of the brain, while we're doing specific rehab to develop their motor skills and to develop their core stability and develop the smoothness of their eye movements, or the stability within their eyes. And the pairing photobiomodulation, the use of lasers, with constructive and age appropriate, developmental appropriate rehab has proven to be a really effective way to improve the function of these kids. And that's what really makes this place special. That's what allows us to reach such a difficult population, not difficult to work with, but a population that not many people know how to work with or know where to even start. And so by doing the right labs, identifying the right metabolic factors, using transcranial photobiomodulation, using photobiomodulation therapy lasers over their gut to improve their gut microbiome, things start to click for these kids. And I'm really excited to be able to offer this. This isn't a video to sell anything, but a lot of people ask on our videos, like, where do we get those lasers, or what lasers, or what's that light, what's that doing, or where do we get that? So we actually sell these lasers. Like we've used them for 7 years, and over the last 6 months, we started actually selling them to patients, selling them to other providers, teaching people how to use them effectively. These are FDA approved for home use. They're the same lasers we use in the office. They are powerful enough to make it worth your time. So there's a lot of LED, like you can hop on Amazon and find some cheap LED panel, and that's just really not going to cut it. You need the power, you need the focus, you need the settings, you need the right wavelengths to be able to make these changes that this article is referencing. So we're going to include a link below, like how you can learn more about these lasers. And what that includes is meeting with a doctor on the phone, at least talking through your child, your goals, your patients, their goals. And that's going to allow us to get the right laser for you. But then after that, we're going to provide training. We're going to provide instruction. We're going to give you a plan based off of your child, based off of their symptoms, based off of how they move, based off of we're going to provide a plan for your child that's specific to your child. There's a lot of different ways that we can use these lasers based upon different dysfunctions, different areas of the brain. There's different settings built into them, but we're going to really narrow it down and take out all the guesswork and make it make sense, make it realistic. If you've got 20 minutes a day, you can make the changes that they're referring to in this paper.
If you like the show, go ahead and subscribe to our channel. Love to have you follow us. Love to have you help learn how to help kids if you're a doctor or a parent that's maybe struggling a little bit, of different things you can do to help your own kid. So see you next time.